my name is Dana, and today with my partners Gerardo and Hannah, we'll introduce you to this project which is called Lifting Nanostores for Mexican Nutrition. As you may know, this project was done in collaboration with the Massachusetts Institute of Technology LIFT Lab and also with other 13 campuses of Tecnológico de Monterrey. The MIT provided us a survey designed to assess local food environments of nanostores in Mexico. We selected a nanostore and applied this survey, which provided us insights that support initiatives to improve last mile operations. To do this, we followed a simple methodology. First of all, we did some field work, which was to collect the data. Then we did the data cleaning. Since, as I said before, we work with other 13 campuses of Tecnológico de Monterrey. And then with this data, we brainstormed some key questions, which helped us to do some statistical analysis. We answered these questions by building some models, and finally, we interpreted the results. The first step was to do the fieldwork. We visited the selected location and we conducted a survey to the shopkeeper. Then we conducted around 14 interviews to shoppers to know about their healthy and unhealthy purchases, their monthly food budget, their consumer choices, and their shopping frequency. And then we observed the last mile operations so that we know some schedules and the brands that principally supply this nanostore. After that, we did the data cleaning. With all the databases from the 13 campuses, we summed up these databases by analyzing the percentage of completion of this survey. Those who didn't have a 100% percentage of completion were deleted. Also, another step was to fill the missing data with the average and the mode. We searched also for duplicated entries, and finally, we encode and categorize variables.
Before choosing a final research direction, we took time to explore different angles of the nanostore ecosystem. We really asked ourselves, where are the most meaningful problems and opportunities for impact? We focused on 5 big themes: healthy purchases, last mile operations, monthly budget of the families, and performance by campus. And of course, always thinking about how demand and offer interact in each context. For this brainstorming, we formulated key guiding questions that shaped the rest of our analysis that helped us decide which variables to prioritize and which hypotheses were worth testing. One of our first questions was, if a shopper rates health as a high priority, are they more likely to purchase healthy products? Interestingly, the data showed a clear mismatch between what people say and what they end up doing. Many respondents claimed health was their top priority, but it did not end up buying as much healthy products as we thought. We also saw a trade-off. People who prioritize health tended not to prioritize price, while those who focused on price were less likely to choose healthy options. In addition, many shoppers believe that the healthy products are much more expensive, which reduced their motivation to buy them. Then we asked if the monthly family budget is higher, does the purchase of healthy products increase? Statistically, the answer was no. The p-values of the variables related to the budget were not significant, so we cannot confidently say that having more money leads to more healthy choices. This suggests that economic capacity alone does not explain behavior. Other social, cultural, or contextual factors like habits, family preferences, or beliefs are probably driving how Mexican families eat beyond just how much they want to spend. We also explored a more strategic question. Do shoppers with larger budgets buy healthier products? And which segments should we prioritize? Even though we didn't find a strong statistical link between higher budgets and more healthy purchases, most respondents still perceived healthy products as more expensive. We observed an inverse pattern. The more people prioritize health, the less they prioritize price, and vice versa. This perception of higher costs can discourage families from choosing healthy options. So an intervention should be considered not only income, but also how different age group and family structures perceive price and value. Then we look closely at the relationship between health and price priorities. The question was, do customers who value health the most really not prioritize price? Quantitatively, each 1 unit increase in healthy priority was associated with about a diminish of 0.3 in price priority. In simple terms, the more people care about health, the less they care about keeping prices low.
Following the same line and analyzing it by campus, how it performed between buying and logistics, we came with these both tables where we can see the count of healthy by campuses and how the logistics performed by each campus. As we can see, they are totally different and they behave totally independent. With these answers, we came to our table where we categorize it by high logistics, low logistics, medium logistics, and high purchase, medium, and low purchase. With this, we can see, for example, Campus Chihuahua has a high logistics but a low healthy purchase. Campus Ciudad Juárez has high logistics and a medium high healthy purchase. And for example, here Campus Puebla has a medium logistics but a high healthy purchase. Matching it with the household income average survey made by INEGI, we can see that some states at the north, where the household income by month is less than the states here in the medium and center of the country, like Puebla, the lower the income, the lower the healthy purchase. And some other cities like Ciudad Juarez, which is a border city with a higher monthly income, has a medium high healthy purchase. With this, I'm trying to optimize the delivery time and making it easier and more efficient. We came up with this question: do downloads with trolley reduce the proxy time? And we can see the trolley has a big impact in the reduction of time, also with a big coefficient. In this case, for a brand, it's cheaper to put one operator and one trolley than two operators, which will make their delivery to the nano stores more efficient and more practical.
We have 5 main conclusions. The first one is about consumer behavior. We know that there's a clear gap between what shoppers say they're doing and what they're actually doing. With statistical analysis, we saw that this is not really a budget-related decision, but it's a complex cultural and social decision. Region level opportunities, we saw that the north of the country has strong logistics, but not that high of a healthy product demand, meaning that there's a lot of opportunities for health product companies to do interventions in this zone of the country. In the center and lower part of the country, we saw a really high demand, but weaker or slower logistics, meaning that there's a really high risk of stockouts or not healthy food available if this is not improved. Then we saw that the goal public of healthy product related companies are young consumers and medium to big families with high budgets and a high intention of buying healthy food. And on the operational inside, we saw that using a trolley it's better than having two people do the job that one people and one trolley has or can do. And this is all from us. We are hoping to develop this project further to help the consumption of healthy products in Puebla. Thank you very much for your attention.